All right, patient one. So, patient presentation. A previously healthy 19-year-old Division One female soccer player presented with intermittent stabbing right hip pain and low back pain for the past 3 years. All right, so past 3 years, we know it's not going to be an acute injury. The pain was localized to the right anterior and lateral hip along the rectus femoris tendon, along with the TFL and gluteus medius. She denied any inciting event or trauma, so that kind of takes out our acute injuries for the most part, usually. The patient indicated her pain was worse after exercise, specifically after running or extending her leg to kick. Okay, could be some sort of tendinopathy in my head right now, or potentially labral pathology, or a cam or pincer lesion, maybe bursitis. She reported taking ibuprofen 400 milligrams by mouth daily for pain, which helped mildly. She denied numbness, tingling, weakness, popping, locking, or clicking in her hip. So that kind of takes out any like piriformis syndrome that takes away labral tear in the hip, um, and cam or pincer lesion. She had completed several rounds of physical therapy over the past 3 years, which helped some but did not completely alleviate her pain. Okay. History. Past medical history is significant for mild intermittent asthma and seasonal allergies. Her medications include Zyrtec and albuterol inhaler as needed. She had no previous surgical history and no prior fractures. Social history reveals the patient is sexually active with one partner, has never smoked, exercises frequently, and has no recent travel outside the country. So it could be a tendinopathy based thing since she exercises frequently. I don't think it's more the cam or pincer lesion since she didn't have any fracture of the acetabulum or the um, femoral head. Physical exam. The physical exam revealed right hip tenderness to palpation along the anterior inferior iliac spine and rectus femoris tendon, along with the tensor fascia lata up the anterior superior iliac spine and down the IT band. The exam revealed a single gluteus medius tender point over the superior iliac ridge. She had full active range of motion through the hip with pain at maximum flexion of 120 degrees. So that already takes out cam and pincer again because normally they don't get to that point of flexion before they experience their pain. They usually get about 90-ish. Um, when she had pain with resisted internal rotation, abduction, and adduction. So pretty much all the motions at the hip except external rotation and hip extension. Patient had a positive Nobles and Ober's test, which test IT band. Um, she also had a positive Scour test or score test, which tests labrum. So maybe labral pathology still. However, the pain was more localized over the origin of the rectus femoris rather than through the acetabulum and labrum. So not labral pathology. Um, no visible ecchymosis is noted on inspection. Strength is 5 out of 5 on all planes of motion. Sensation is overtly intact, and deep tendon reflexes were 2 out of 4 bilaterally. So reflexes were normal, full strength, full range of motion, neurovascularly intact. So for my differential diagnosis, I'm going with either trochanteric bursitis, since that is an overuse injury, and could explain why she had a positive Nobles and Obers test, as the IT band kind of rolls on the greater trochanter. And then potentially like a tendinopathy of the rectus femoris.